Hey fam, and welcome to the Happily Ever Active podcast where Disney magic meets health and wellness. I'm Stephen Kabibi, your friendly personal healthcare companion, and I help travelers like you physically prep for your next vacation so that you can walk more, enjoy longer days, and make magical memories with your loved ones without burnout. This week, Dr. Emily Bohan joining me again on the podcast to answer listener questions on how to deal with low back pain while traveling to the Disney parks. If you've dreaded your first day of traveling because you have a history of low back pain and you don't want to ruin your entire trip, or if you're afraid that your low back pain is going to slow everyone else down while you're traveling, or even if you just want some recovery tips that'll help with your low back so that you'll feel a little bit better on the next day, this episode is definitely for you. Now, before I move on, I do want to announce that Disney DPT is now Fit for the Magic. On Fit for the Magic, you'll get the same great content to help you stay pain-free on your next trip, but just under a fun new name. You can find me at fitforthemagic.com and on Instagram at fit.forthemagic. Find everything, including my pocketbook guide, Disney Ready, your pain-free park survival guide, on fitforthemagic.com. And if you learned something useful on this episode, please share the show and tell a friend. Okay, here we go. Emily, welcome back to the Happily Ever Active show. It's good to have you again. How are you doing?
Good, thanks. Yeah, excited to be back.
Definitely happy to have you. So this evening we are going to be talking about how to deal with low back pain while you're traveling, while you're flying, while you're driving, while you're going to the Disney parks especially. And leading up to recording this episode, I polled my followers on Instagram to ask if they have any specific questions on dealing with low back pain. And I got a number of questions. So why don't we go ahead and answer those questions and then see where that takes us? Sound good?
Yeah, that sounds good. I
Okay.
mean, there are so many people who deal with low back pain. I think it's like 70, 80% of folks have had some degree of back pain in their life. So, good information to have, even if you've never experienced it.
For sure. Yeah, absolutely. And like, you know, when thinking about traveling, this could be for the traveler that like dreads that first day of traveling because they've been dealing with low back pain, or they've had back pain in the past and they don't know if it's going to come back during the trip because they've been sitting, or they're going to be anticipating sitting so long while they're traveling or walking a ton while they're at the Disney parks. It's for anyone that's like afraid of their low back pain slowing them down when they're with their group, especially if they're planning to do a ton of walking at the parks or trying to get from terminal to terminal at the airport. Without further ado, let's just go ahead and go into these questions.
Excellent.
Okay, so one listener sent in a question. They said, my mom has a bad back and cannot stand in line. So she must be referring to like standing in line for a ride, so in the queue. Are there any stretches to strengthen her back?
Yeah, so that's a great question. I feel like a lot of people low back pain comes on with sedentariness. It's not necessarily always with movement. We often
Hmm.
get more of that back pain when we're not moving our bodies, and that includes when we're in these like static standing line positions. So, what I often see happen is people's muscles get tired. We start relying
Hmm.
on passive structures, right? We kind of want to go to end range joint motions rather than relying on our muscles to support us. So, a lot of people that looks like locked out knees, our
Hmm.
pelvis is maybe tilted forward or tilted too far back, our core isn't really engaged. And after being in that position for an extended amount of time, that can start stressing out some of those structures through our back and causing some of that achiness or creakiness that occurs. So I'd say the first thing to make sure is check in with yourself and like, what are you doing with your posture? Are your knees fully locked out? Is everything with your pelvis just kind of like dumped forward and you're hanging out in an
Hmm.
anterior pelvic tilt? And if so, can we do a little bit of a tailbone tuck, a little bit of that deep core activation of our transverse abdominis? So that's that really deep internal muscle that helps support our low back. And gently, the knees don't need to be really bent, but make sure we have like a gentle bend in our knees. So those are kind of my first couple of thoughts that I have when it comes to low back pain when you're stuck in these static postures. I work with a lot of people who have hypermobility conditions, and they tend to especially end up in these extreme ranges of motion. And so, even for regular people, what can sometimes even help is like switching, like putting one foot a little further forward than the other and switching back and forth, or like doing some like standing rotations, right? Like do something to help get your body a little bit, get your body moving a little bit better. So that way you're not just in this like one position that eventually your body starts to go towards that like passive structure standing.
Totally. Yeah. And, it's really important to emphasize that whole idea that it's not your posture that's the issue. It's staying in that posture for a really long time that causes those muscles to get tired and rely more on your passive structures. You mentioned so many good ones, so many good postures that people tend to like sink into. Another one that a lot of people tend to sink into is like leaning towards one hip and letting one hip drop so that they're leaning onto that hip. Really just finding ways to move, right? Finding ways
Mhm.
to move is going to be really important. And then in terms of um, strengthening your back, really a lot of the research that's coming out and has come out has found that general exercise is one of the best things you can do to treat low back pain. And it's kind of on one end, it's kind of discouraging to hear that it's general exercise that helps because us as physical therapists, we're like, what's the one thing that's going to help you? We always, or a lot of people tend to think, oh, there's going to be one thing, one exercise that's going to help you, when in fact, on the flip side of that research, really any exercise can help you, and it's beautiful because all you need to do is find something that you really like to do. So one of the simplest things you can do to strengthen your back is to go for walks. And then, if you're already walking 20 minutes a day, then maybe you walk 25 minutes a day, 30 minutes a day, or walk a little faster, get your heart pumping a little harder. In preparation for your travel, doing something that challenges your body a little bit more than what you were used to is going to help strengthen you. And then on top of that, do something that you love to do. If it's walking, like walking the dog, do that. If it's going for a jog, do that. If it's hopping on the elliptical, do that. Something to get you moving that you love is probably going to be your best bet to strengthen your back.
Yeah, I think that really speaks to part of what leads to low back pain in these static postures is lack of endurance, right? And so that's why general exercise works, is that we're increasing like the strength of endurance of the whole body rather than just trying to pinpoint, oh, this is the exact one problem.
Mm-hmm.
It doesn't
Mm-hmm.
usually work like that. And especially when it comes to when we're asking our body to do these challenging long endurance days, right? Like doing some form of activity. And I think you had a really good point, Stephen, of doing something you enjoy. Because with my personal training background, something that I often see is people are like, what is the best exercise for toned abs or to lose fat or, yeah, low back pain, right? And yeah, maybe there are some exercises that might be like slightly more optimal, but at the end of the day, what are you going to do most consistently? And that's going to
Right.
get you the furthest. Rather than if I give you something and you hate doing it, you hate it, and you 50% of the time don't end up going and doing that exercise, it's not going to help you. Not as much as, something that you do enjoy. So yeah, I think that's really important to keep in mind. Hmm.
Exactly. I mean, I couldn't have said it any better. Another listener asked, how do I keep a good posture when standing for so long? I think this is a good question to ask to follow up with that last question.
Yeah, I think those tie in really nicely together. So I do think it comes back to, again, making sure you have like the strength and endurance of those muscles. Most of us do have a favorite side, like you mentioned, Stephen. When we get tired, most of us kind of like to lean onto one hip or lean onto the other hip. And so, picking up on some of your tendencies to do that and correcting yourself as much as you can. When I say
Mm-hmm.
correcting yourself, it doesn't mean you have to be a robot and stand perfectly the entire time. Like, nobody does that, right? The movement piece, I think, is really essential. And so, maybe if you're leaning on one hip for 5 minutes and you're like, oh, yeah, I've been leaning on my right hip for a little while. Maybe you switch to your left side. Or, like I said, maybe you bring one foot forward. Um, so something like that. I think good posture is not necessarily static. I think good posture is moving between different postures. But I think things that can like generally help, like I mentioned before, is making sure that your knees aren't fully locked out when you're
Yeah.
standing. That you aren't in a big anterior pelvic tilt, so where that pelvis is like dumping forward.
Mm-hmm.
Paying attention to talking about posture. Are you here on your phone for half an hour waiting for the ride line to come down or waiting for that travel line, whatever, to
Yeah.
come down, right? Like that also is going to affect pain in certain areas of the body.
Yeah.
So yeah, making sure we don't when we talk about upper body, they're not in this like rounded forward head like we're staring at our devices, which we all tend to do sometimes. So yeah.
Like you were getting at, really gets it to this overarching idea of there really is no perfect posture, right? There's no posture that we need to strive for that's quote unquote perfect. It's again just this whole idea of avoiding being in one position for too long to where it gets uncomfortable. What you were talking about brought up an idea that I want to bring up, and it's really just taking a step back and really talking about body awareness. Um, when I'm working with clients, when I'm working with patients, I really love to bring in the idea of body awareness into the exercise that they're doing. Where do they feel the pressure on their feet, on their hips? What muscle might they be feeling getting a little bit of a stretch with this exercise? Same thing can be said for any little movement that you're doing to feel a little bit better. If you're doing a little pelvic tilt, or if you're doing like a little cat cow while you're standing, what do you feel moving? What part of your back is getting a little bit more of a stretch? What feels a little bit more comfortable to you? Because the more you're aware of how you are moving, the more you'll realize what works best for you, and the more you can cater that sort of movement to fit you and how you feel in the moment. So that way a cat cow for you isn't necessarily going to be or feel like a cat cow for another person standing in line next to you. It's going to be your cat cow because it's how you learn to move optimally for your body.
Yeah, I love that. I think body awareness is a huge part of this and like understanding what your tendencies are and yeah, and how you can adapt certain exercises to make that feel better. Absolutely.
Next question. So this listener asked, what if I have a sore back after day one? So, like after day one of walking all day at the theme parks, can I keep going to the parks with my family? So off the bat, let me go ahead and say yes, you definitely can.
Yeah.
You don't want to let that stop you. But if you have a sore back after day one, that doesn't mean it's the end of the world, right? There are certainly ways to help recover for your next day. There are certainly ways to deal with that soreness if it carries on into the next day. The one thing I will say is, if you're listening to this answer that we're giving you now, I would say even before going to the theme parks or before going on your next trip, develop this body awareness that we were just talking about, but also develop this awareness of, oh, this amount of walking makes my back feel this way the day after. So that way you can kind of anticipate how you might feel when you're going to the parks or when you're traveling, when you're flying, when you're driving. That way, you know when you need to take a break when you're at the parks, when you need to slow down, or when you need to do some stretches. That way you don't even run into this problem in the first place. Now, with that said, if you still feel sore after day one, I would encourage you to bring maybe one or two massage tools while you're flying. So I have a list of 15 must-have items to have a pain-free Disney trip. You'll find that in the show notes. But one of those items is a mini foam roll, which I personally love because it packs really easily into like a carry-on backpack, into luggage without even, it's like 1 foot long and it's like probably the thickness of this. It's really tiny, really easy to use, and um, really intuitive to work on the low back. You can use like a lacrosse ball to help massage out the back. Really, just find ways to stretch out the back, desensitize the back, help recover that evening, so you'll feel a little bit better the next day.
Yeah, I think that's all. Lots of gems in there for sure. But yeah, I think it's really great to think about, you know, at what point when I was walking around the parks did I start to experience that low back pain? And then the next day in the park, understand that, okay, I already have some fatigue in my system. How can I incorporate maybe some more breaks so I don't hit that same point, right? Okay, 4 days in, I started getting back pain. Maybe every 2.5 hours, I give myself like a little 10-minute break. I do maybe a few just like standing or sitting stretches of some sort. Make sure that I have enough water and hydration as
Mm-hmm.
well. Making sure you're eating enough. I mean, that all comes into fatigue, which can play into low back pain. So, yeah, so I think that's all really important. I love that you mentioned bringing a foam roller or a lacrosse ball. Great way to do symptom management. And then as well, I also really like incorporating, okay, now your low back muscles are tight and fatigued. Working through them is really helpful, but let's also bring some other muscles that are supportive of the low back, like
Mm-hmm.
glutes, core, making sure we have good breathing patterns, like bringing those pieces in too. So that way the low back doesn't feel like it's doing all of the work all of the time. So, for example, maybe you foam roller lacrosse ball your low back, and then you follow it up with some bird dogs or dead bugs or glute bridges, something else to get other parts of the body moving.
Yeah, yeah. That way you're bringing some relief to the back. Because really, what
Hmm.
it sounds like what you're getting at is, when you're walking around and you're starting to feel that back stiffness or back pain, a lot of times, not necessarily all the time, but a lot of the times with the patients and clients that we see, it tends to be that stiffness and tightness and pain tends to be because the low back muscles are just working overtime. So
Hmm.
it sounds like what you're saying is if you work on other exercises to emphasize surrounding muscles, the hip muscles, the core muscles, then that helps to relieve some of that tension, relieve some of the work, the extra work that your low back muscles has been doing, right?
Yeah, exactly.
Yeah, I love that. And then, to circle back, because you almost breezed over it, but to emphasize again, sleep, nutrition, hydration, those are massive, massive, massive factors when it comes to low back pain. And it's something that is getting talked about more, but I still think it's very underrated treatment and strategy when dealing with low back pain. When we treat patients and clients with low back pain, we want to address the multifactorial nature of low back pain, right?
Hmm.
So making sure that your sleep hygiene is good, you're sleeping and all lights are off. Make sure that you're sleeping at a reasonable time and getting between 7 to 9 hours of quality sleep. Make sure that you're limiting your phone time before bedtime, making sure that you're limiting caffeine after 3 p.m. Like all that stuff is huge, and people don't realize how much it has an impact on your low back. So that's sleep. Let's talk hydration, right? You got to drink. You recommended on the last time you're on this episode half your body weight in ounces on a normal day. So when you're
Yeah, that's a
traveling,
minimum.
right?
Yeah. Hmm.
Exactly. So when you're out in the parks, you got to drink more than that, right?
Yeah, exactly. I think that's one of the most underrated things and probably hard to hit because you're
Yeah,
not thinking about hydration.
for
You got to
sure.
carry a water bottle with you or stop and buy water or anything like that. So I do think that that especially gets overlooked in playing into muscle function and making sure that you're not fatiguing your body out too much.
Yeah, yeah, absolutely, absolutely. Uh, and then stress. Stress is something that we especially when we're traveling, it's really easy to fall into this trap of, oh man, I'm gonna miss my flight. I got to get there really early, and then you fall behind, and now you're trying to run to your flight. Or, oh man, I got to get my Lightning Lane reservation for the ride at Magic Kingdom. Got to make sure I wake up on time. Or, oh man, like the kids are just being so annoying right now. Or there's so many things that can affect us and how we feel on our trip, and all it takes is just a couple things for your stress levels to skyrocket,
Mhm.
and that really affects the way we perceive how our back is feeling. So being able to handle that stress and know how to deal with it is going to be very important, especially if you're someone that's already dealing with low back pain.
Yeah, I think it's even important to consider that, it can also be good stress. It can be the good stress of being out of your usual routine. It can be the good stress of you're really excited for your trip, but maybe your sleep is a little more broken beforehand, right? Like when
Mm,
we say stress, I feel like it always has a negative connotation.
right,
But sometimes, there's eustress. There's good stress too. There's the good stress of exercise, which helps our body adapt. But I think it's really good to keep in mind that our bodies kind of perceive all stress, whether it's good or bad stress, the same way. I like to think of it as a stress bucket, right?
right.
And the higher up we get in our stress bucket, we don't want our stress bucket to overflow. And that's when we start to get more symptoms of things like low back pain. And so, doing a little reflection on what are certain things to help lower my stress bucket. Maybe that's like reading a really good book when you have a little bit of downtime in the evening before your next day in the park, or making sure that, yeah, like we talked about hydration or eating a really healthy meal for yourself. Like, what are
Hmm.
things you can do to reduce your stress bucket so that way your stress bucket doesn't go so high that you're starting to get symptomatic. So, because yeah, I see that all the time in practice. I'm sure you do, Stephen, as well, that nothing else in someone's life changed except for they have some big stressor that comes into their life, and now their symptoms all of a sudden feel a lot more exacerbated, right? So, I think that's something that, yeah, like I said, gets really overlooked. And maybe that's just like taking 5 minutes to slow down when you're on this amazing trip to just go sit in the sunshine and do nothing and just sit with it. And maybe you people watch or bird watch or whatever, but you just take 5 minutes to like slow down for a second. I think that can also make a really big difference.
I was gonna say, yeah, like for me personally, because I know that I get pretty uptight about making sure I get on my flight on time and get to the parks on time. So for me personally, because this is what I've been practicing for so long, I get to the airport early. I sit down at my gate and I just chill. I'll take a couple breaths, maybe people watch. So that's my way of handling stress. Because like you said, all stress is just your body perceives it as stress, whether it's good or bad stress to you and how you feel it. It's just stress.
Mhm.
So how we deal with that stress is important. So that's the way I do things at the airport. Um, when I'm at the theme parks, for example, a lot of people fall into this trap of when you try to make rope drop and you're surrounded by hundreds of people walking into the park, all trying to get to that one ride that everyone wants to ride, because if they go and miss that ride and wait until the afternoon, it's going to be like a 3 hour wait. Once you're in that group of people that is just trying to hightail it to the next ride, it gets really, really stressful just being in that environment. So for me, as I'm walking, it sounds kind of silly and crazy, but I'll walk and I'll just take deep breaths. And when I mean deep breaths, I mean I'll take a deep breath in for a count of four. I'll hold for a count of four, and then I'll take a deep breath out for a count of four, and then I'll hold for a count of four. And listeners might be, hearing this strategy and they're like, "How are you doing this while walking? Like, what the heck are you doing?" For me, it's something that I practiced for a while. It's become habit, so I'm able to do something like this. For you, it could be something as simple as, okay, I'll do that breathing strategy while I'm waiting in line for the ride. I'll
Mhm.
get to the ride, get in line, and then I'll let myself de-stress by doing that breathing pattern. Or you could practice that breathing pattern on your own in such a way that, again, it becomes habit, like for me, and then do it, whenever you feel like you need to.
Yeah. So oh, I love that so much. Breathing has so much more to do with the health of the body than what people realize. It's such an overlooked thing. So box breathing is the name of what you just mentioned. That
Yep, yep,
four
yep.
four
Thank you.
count
Yes.
inhale, hold, exhale, hold. That was originally created for Navy SEALs and Navy SEAL training in order to help them calm down their nervous systems. So it is like super backed up in research, right? Like top of the line, like fit humans use it to help re-regulate their nervous system. So I think there's something to be said about that. I also know there's another strategy too that long exhales tend to calm down the body. So
Mm-hmm.
doing like two fast inhales and a long exhale. So can also help re-regulate
Yes.
the nervous system. And the reason why you're like, some listeners right now might be like, why is breathing related to my low back pain? Your diaphragm actually comes around and attaches into some areas across your ribs in the back, right? So being able to breathe in 360 degrees through our bellies, through our sides, through our back can actually help relieve some low back tension. So that can be a really helpful tool to use, not only for stress regulation, but even for your low back pain as well. As a pelvic floor physical therapist, something I see a lot of is really dysfunctional breathing patterns. And our
Mm,
breath has to do with back pain, which has to do with pelvic floor function. All of that is interrelated. And so if you can breathe better, you're essentially going to support your low back better, right? So I think that's really important to speak to. So there's a really interesting piece of research that came out that looked at like CrossFit weightlifting individuals. And they asked these folks, like, do you have low back pain or do you not have low back pain?
mm,
And what they found is they took uh, the thickness of their diaphragm, and they found that people with low back pain actually had less thickness of their diaphragm, which the researchers concluded
interesting.
there could be like a factor of these people don't know how to correctly like breathe and use their diaphragm as well, hence why it's not as hypertrophied
Mm-hmm.
or as
Mm-hmm.
thick, right? And so that kind of shows this piece of how our diaphragm, our breathing muscle, and our low back, and how low back pain, how that can all be correlated together. So even if you're not like an intense athlete, I still think that this research shows that how you breathe does affect the function of the rest of your body.
Yeah, yeah, totally. And
Hmm.
for just in case listeners don't necessarily know what hypertrophy means, it really just means how developed the muscle is, right? So
Hmm.
you're getting at those that have that low back pain aren't using that diaphragm muscle as much, so it's not as well developed. So yeah, there you go.
Hmm.
That's amazing. And then to go back to the box breathing that you're talking about and how it's been used in Navy SEALs. Look, if Navy SEALs use box breathing to make sure that they can handle the rigors of everything that they're doing, whatever they're doing in training or in combat, if it works for them, then dang, it's probably going to work for us. So, yeah, that's
Yeah,
awesome. That's awesome.
exactly.
Okay, let's see. Let's go on to the next question. So, one listener said, should I bring anything to anticipate back pain? I thought this was a pretty good question. What do you think?
Yeah, yeah, I thought that's a great question as well. So I think a few of the things we talked about and some of the other questions tie
Mm,
in really nicely to this one. So you mentioned how you can bring a foam roller along, you can bring a lacrosse ball to help desensitize and get those muscles to relax if they do get tight on you. I think also potentially even bringing some exercise bands along so that
mm-hmm.
way you can do some like therapeutic directed activity outside of your time in the parks that can help hopefully reduce or get rid of any back pain if you do have some, or even doing a little bit of some targeted exercise before you go into the park just to get the right things activated
Yeah.
can hopefully help prevent it from even happening. So those are the first tools that came to mind for me.
Yeah. You mentioned exercises to do before going to the park. So like a good warm up, really.
Hmm.
And
Exactly.
funny that you mentioned that because a good warm up is something that I talk about in my book, Disney Ready, Your Pain Free Park Survival Guide, which I go through an entire warm up that you can do before you go into the parks. But you could also use that warm up or parts of that warm up before you go to travel, before you get into the car to go for a long drive. So, yeah, lots of ways that you could do that. Uh, another thing on top of the foam roll and the lacrosse ball, a lot of people like to bring like a massage gun with them. Totally cool because it's a very similar way to do some recovery. I can't discount like an Epsom salt bath because some hotels have bathtubs that you can use to get that bath going. Even something as simple as like a warm shower. or a hot pack or a cold pack, depending on what works for you. Lots of different ways and strategies that you could do this. Since we're on this topic, I wanted to ask what your thoughts are on this, Emily. What about medication, anti-inflammatories? Any thoughts on those for low back pain if you're going to anticipate it?
Yeah. I think that there's a time and a place to use medication. I think if you're relying on it consistently every day, I think it's good to have resources to address that. But if you know you're pushing your body to your limit and that you experience low back pain towards the end of some of your park days and you're kind of already implementing everything that we've been talking about, yeah, I think ibuprofen or Tylenol definitely has its time and a place. And I think that's totally fine to use.
Yeah,
Mhm.
I agree, 100%. There's a time and place for it. In practice, as a therapist, I like the ability to use medication as a way to be able to get more movement into your day.
Mhm.
Now, of course, if medication helps you do movement, which we talked about earlier, how movement can help relieve back pain, great. But if medication is something that you take so you can move, exercise, and walk all day, knowing that it's going to make things worse, that's a different story.
And I also think it's important to distinguish between, okay, things get a little tight, sore, and achy. Ibuprofen is going to help me manage that on top of
Yeah.
everything else I'm doing. I'm okay with that. That's a different story than now I'm experiencing like a sharp pain in my foot or
Mm.
my hip, right? Like something that's a little more acute. Also know when, okay, I'm using ibuprofen to help extend my time in the park versus now I'm using ibuprofen because I'm starting to feel something that's a little bit more potentially of an acute injury and I need to listen to my body. So I will say that there's a stipulation there.
Yeah, yeah, exactly. So let's see. I have two more questions before we finish up. So this listener sent in a question. They said, "Do certain bags prevent low back pain more than others? What might you recommend?" And this is a really good question because not only are Disney guests typically wearing bags when they go to the theme parks, but of course, you're more than likely going to be wearing a bag when you're going out traveling, getting onto the plane, or even like carrying stuff to get into the car. So yeah, this is a good question.
Yeah, I think this is a great question because prevent low back pain versus I think can contribute to some issues with low back pain. So I don't think there's a cure-all bag out there.
Yeah.
I'll say that. But I think anything that you can have that is strapped close to your body, maybe even has a chest or a waist strap, like the center of mass of the bag is close to your center of mass of your body, so it's like right on your back.
Yeah.
That's always going to be your best choice versus something that's more of like a cross-body bag. You're kind of weighting one side of the body more than the other. So that can sometimes make the low back feel a little more achy or sore on one side. I think those are all good things to consider. So think really close, weight is evenly distributed on your shoulders. If you can get something with straps across the front, that pulls you even closer to your
Mm-hmm.
body, so it's even
Mm-hmm.
easier to carry,
Yeah.
right?
Totally. And this question really speaks to a lot of people that I see at the theme parks. Their bags called lounge flies. And these bags, the straps, the way they're made, even if you tighten the straps all the way to get the bag as close to your body as possible, they sit really low onto the hips and sometimes even going down into the buttocks. And that can definitely contribute or be some sort of factor into how your back might feel at the end of the day. Just because, like you said earlier, when you're carrying something of weight on your back, you want it to be as close to your center of mass as possible. The farther it is from your center of mass, the more your back or the more your body is going to be working to hold that. Now, there's also something to be said about carrying a backpack really, really high up onto your shoulders. I think that is a contributing factor to like upper shoulder, maybe even neck pain, right? So
Mhm.
not necessarily up into the shoulders, but definitely not into the low back, somewhere in the middle.
Yeah. And I think I'm going to share a little bit of a personal story because I think maybe this might help some of the listeners too. When I was in college, I didn't have a great fitting backpack. It was a little too far out from my body, and it only had a water bottle carrier on one side of that backpack. And I used to walk like 12 to 15,000 steps. I went to
Oof.
University of Florida, and so like some of my classes were a mile and a half walk, right? I ended up having some left SI joint pain on and off through my first semester. Anyways, I could not figure out what it was. I had pretty good awareness being a personal trainer. I was like, what is
Hmm.
going on? Anyways, I realized I was carrying this like giant water bottle on the one side of my not great fitting backpack. And I was like, there's no way it can be that. Like I'm pretty strong. It can't be that. But I was like, I'm just gonna try sticking it in my backpack either in the middle or like, yeah, just try to like even out the weight. Took probably a couple weeks and my back felt so much better. So, yeah, so I'm not saying that like the placement of your water bottle is like the cure all, but I do think that story shows that like the way
Yeah,
we carry the load on our body, especially when you're like active for long periods of time, like it can accumulate into fatigue in certain areas of the body. So,
exactly.
yeah, so pay attention, like even if you have a backpack on, like is everything like weighted onto one side? Right? And like trying to get that better fit and make sure that that weight is evenly distributed can really help, especially if you're prone to low back pain.
Yeah, yeah, totally. And a couple other things to think about, how much are you carrying? How heavy is your backpack?
Hmm.
How big is your water bottle? Because, a 32-ounce water bottle is a lot heavier than a 12-ounce water bottle, which, by the way, I use a 12-ounce water bottle, and I have that on my list of 15 must-have items for a pain-free Disney trip. Um, but also, you mentioned carrying like a crossbody bag on one shoulder, right? Are you carrying that crossbody bag on one shoulder all day, or are you switching sides halfway through the day? Because that makes a big difference too. It's going to
Hmm.
feel awkward switching, but man, it's going to make your shoulder feel a lot better if you're carrying something all day like that.
Hmm.
Um, One of my favorite backpacks to use is called a Jansport half pint mini backpack. Think of the typical Jansport backpack that a lot of kids like to use for school, but cut it by like a third. And it's that
Hmm.
tiny backpack. It carries everything I need to go to the Disney parks, and it has a lot of extra room in it. So it's almost too big for what I need, but it's tiny. It's great. So,
Love that.
oh, and then going back to like flying and carrying your luggage, making your backpack as light as you can is going to be big, especially when you're traveling. Doing little things like getting a backpack that you can that has a loop and you can put it onto your luggage is going to be big for you. That way you're not carrying the backpack while you're walking around. So, lots of different strategies for that.
Yeah, I love that. And even for people that, they're really sensitive to carrying loads on their back, if you're going somewhere that's easy to have more of like a roller style bag, they
Mm,
have plenty of bags now that are even small enough. I have a little roller bag that can actually like slide under my seat. It's small enough for that. So there's lots of
that's
luggage
awesome.
options out there. So like explore your options too.
Yeah, you're gonna have to send me a link to that. I'm gonna have to put that in the show notes because I did not know that was a thing.
Uh-huh.
Did
Yep.
not know that was a thing.
Hmm.
Cool. So we are coming on to our last question. So let's go ahead and finish up there. So this listener asked, are there stretches that can be done in the car, specifically for low back pain, of course?
Hmm. Yeah. So the first thing I want to say is tying back into what we were saying before, that movement is medicine. And so
Mm-hmm.
sitting really stagnant in the car and allowing some of that tension to build up, the best thing you can do is do these little like micro movements and adjustments. And honestly, just like kind of being fidgety is going to help prevent some of this
Yeah.
from happening in the first place, right?
Yeah.
So you are a little more restricted, obviously, in the car with what kind of stretches you can do, but doing like a seated figure four piriformis stretch to help stretch out the hips a little
Mm-hmm.
bit. You'll even get the low back moving a little bit when you lean forward. A seated cat cow to get the lumbar spine moving through full range of motion. Doing some like seated rotations,
Mm-hmm.
right? I think all of those things essentially comes down to what we've been talking about of there's no one best posture, but the more that you can even get these small micro movements in, that can really help. But then also when you're in the car, have a look at what does your seat position look like? How far reclined back are you
Right.
versus forward? Can you maybe roll up your jacket or something like that and stick it behind your back for lumbar support if
Mm-hmm.
the car you're in is, putting you into a ton of posterior pelvic tilt in your pelvis. So think
And you're
like
like
there's a
slouching.
really big slouch in your
Yeah.
pelvis. Yeah, is what I'm
Yeah.
getting at. So sometimes like giving your low back a little support, even if you have to makeshift it, like I said with your jacket, that can be really helpful.
Yeah, yeah. And again, we talked about movement. We also talked about trying to make sure you're finding a comfortable position for you. So, some people might like that lumbar support because getting into the more of that lumbar extension, anterior pelvic tilt feels better for them. Some people might like it the opposite way where they're going the other
Hmm.
way. It really depends on you. And again, it goes back to that idea of body awareness and figuring out what works for you and what might not work for you. Another thing that you could do instead of putting like a towel or a sweatshirt at your lumbar spine to get more of that extension, you could also put it under you so you're sitting on it. I've found in practice that making sure that your hips sit higher than your knees when you're sitting anywhere really tends to feel a lot more comfortable. And believe me when I say this, and I encourage you to try it, but when your hips are above your knees, it's a lot easier to sit with less of that slouched position than if it wasn't, if the hips were at the level of your knees. And a lot of my clients have found that that's a lot more of a comfortable position to maintain for a longer period of time. And especially in a lot of these cars with bucket seats, where it's really easy to get into that slouched position, finding a way to sit up more so your knees are below your hips helps a ton.
Yeah. Yeah, I don't know why car manufacturers, some of these seats are so deep, and some of the clients I've worked with, yeah, it ends up being a big contributing piece if they're spending a lot of
Yeah.
time in the car. So I think that's a great piece of advice of like trying to get the hips up a little bit higher.
Yeah. Yeah.
Hmm.
I don't think I have anything else to add to what you've already added for stretches. Like all of that is fair game. And I'm willing to bet, you, the listener, might even have other stretches that you've either discovered or found on your own that works for you. By all means, like, that might even be a good question to ask the listener is what stretches do you love to do whenever you're traveling in the car, in the plane,
Yeah.
at Disney? I'd love to hear what you have to say because I'd love to share that with
Hmm.
our other listeners.
I do have one other comment to that. I feel like most people, they try and just drive these long distances,
Oh
get
my
there
gosh.
when they can, like 6 hour road trip, we're going to stop once for a potty break kind of thing. And I think there's something to be said for it's okay if you get to your destination 10 or 15 minutes later. If you took a few more stops along the way to get out and move and stretch a
Hmm.
little bit outside of the car, and then you get to your destination, you don't feel nearly as crampy and achy and all of that. So there's something to be said for slowing down a little bit and not trying to do these like huge long stretches of a road trip getting to your destination if you don't have the time pressure there.
Yeah, yeah, that's a really, really good point, and that's a good way to end the episode. Like that 15 minutes might actually save you the rest of your trip.
Yeah, exactly. It won't be an uphill battle, hopefully, from there. Drink your water, do your stretches, get out of the car, do
I
your
love
box
it.
breathing.
Yes, yes, do all the things. Do all the things.
Yes.
All right, Emily, thanks again for joining me. Why don't you go ahead and remind the listeners where they can find you? Of course, I'm going to put all your information in the show notes.
Yeah, absolutely. So I do both remote and in-person physical therapy as well as personal training and nutrition coaching. So my handle on Instagram, TikTok, Facebook is Bohan PT Training. So that's where you can find me for those. And then my website is bohanpttraining.netlify.app. All of that is places that you can find me here in Denver. I just started a little bit more of my in-person clinic. So that's just in like the south of the city, Denver region. But I would say probably around two-thirds of my practice I treat remote at this point, which is great because you can get quality care
Hmm.
from
Hmm.
anywhere. You can get it from the comfort of your own home. So
Awesome, awesome, awesome. Well, thanks again for joining. I look forward to having you again in the future.
awesome. Thanks, Stephen.
That's all for today's episode. Instead of giving you key takeaways from my conversation with Dr. Emily Bohan, I encourage you to stay tuned for our next episode together when we talk about our top tips when dealing with low back pain while traveling. Now I want to turn it over to you. What stretches do you like to do to relieve low back stiffness or low back pain whenever you're traveling? That means traveling on plane or in the car or walking around the Disney parks. Let me know what your answer is in the comments. If you love what you hear and you want to learn more, I encourage you to head over to fitforthemagic.com, where you can find your free guide, 15 must-have items for a pain-free Disney trip. And if you enjoyed this episode, please make sure to share it with anyone who might benefit from it. And of course, please leave a rating or review in your favorite podcast app if you enjoyed the show. This helps me tremendously as I move forward with new episodes to come. I hope you'll tune in to learn more about how to have a pain-free, soreness-free, and exhaustion-free vacation so that you can make magical memories with your loved ones.